You guys have an early shift now that comes in and kind of sets
We've
the
always
rooms.
had a 5 o'clock shift, yeah.
Have you? Which is nice, because you can go into the rooms and.
Even from that point, we have pictures in every room, and when the cleaners come through at night, we ask them to put them in this position. So we have actually a photo on the wall, and they actually are really good about putting their stuff in.
That's awesome. I think we've tried something like that before, and our furniture still at times will just be in a disarray. You know, there's traumas and stuff that come in the middle of the night too, and you just have to double check things. But it's not uncommon to to go into a room in the morning and find furniture all over the place. So go ahead and work together and arrange the furniture the way that you think it should be according to how this patient is. Before we put our sterile stuff on the tables for opening.
We have 4
Oh no, I'm sorry, how's it going? So let's do second.
Take your
I don't really know how these go. I feel like it's for when we bring our packages.
Is this for opening or just?
At least the same.
well, you're gonna open and you're gonna want that furniture where it is for opening. No, this is UW.
This one's a little bigger. So that's your back table, that's going to be your back table.
Yeah.
It makes it close, right?
All right, now, the 4 of you that are closest to this big strip of counter, go over to the case cart and pick out the instrument pans and whatever packs you need.
Is that right? That's the back table.
Put them both in there.
Biohazard bag that at the end of the case we just throw it away because they have dirty stuff on it. So it's not a nice closed.
You're gonna
Oh, you got the basins over there.
Oh, yeah,
Oh,
there's
yeah, well, one.
Unless it's like a reprocessing item, so something like eyeballs or whatever, we take it to refill. But all right, good. So we're ready to open. This looks good to you guys.
I don't know.
All right. In your manuals, how many of you guys have printed off your manuals for St. Mary's UW setups? Have anybody, you guys looked at them?
It's like 48 pages.
Okay.
Yeah, I got it, yeah, I think so.
So here is a printed off list for the UW setup. All right, and I'm gonna say this again and again and again. Some people are very black and white in the OR, not black and white, gray. People do things differently. We're teaching you a way to do it that makes sense, that's efficient. You're gonna go to your clinical site and you're gonna see people, one day someone might do the UW setup. It'll look pretty much the same, but there might be small differences. What I say, my recommendation is pick up what works for you from each of the preceptors you're with, because you're gonna find something that makes sense and you're like, I really like that, works good for me, use it. So it's not gonna be perfectly the way we set up right now, okay? So if you guys wanna use this as a reference in your manuals, page 19 through 22 is UW. We have this little board back here too. That would be nice if you wanna put this up for like a little cheat sheet. But I feel like when you guys are first doing this, you rely on this rather than using your head to retain the information and kind of use that critical thinking. But eventually when you guys are working on your own, it is kind of nice just to peg these up here and you can use them as a reference. Or whatever notes you take now, I don't care. You guys can use whatever you want, post it up there, and go with that.
As odd as it sounds, we have cheat sheets for a lot of different doctors at the U. And that's the other thing, or at St. Mary's, when you get to St. Mary's, there are, say Dr. Logier's doing a laminectomy and you're going to be in there, you can ask whoever's your preceptor they have, a lot of the doctors were working on getting cheat sheets for every doctor for every procedure, what they use, what to put up on the Mayo stand, little quirks of what they do, and that's a very handy thing to do. And I actually have done it working back into ortho and stuff on totals and tape it to them. It's kind of nice to have around. So.
Yeah, it is, especially when you don't do it all the time and you don't work with those surgeons all the time. It's really nice to have that. So, and that's okay. This looks good. So your back table, they kind of do look like they're the same size. Generally for your working table, this is correct. The pack goes on the working table. You're going to want the bigger table. And then the gown table is your drapes, your gowns, any extra pans would also go on this table. So you're going to want the smaller pan, or the smaller table. St. Mary's keeps their Mayo stand in the middle of the two tables. UW does not. So your Mayo stand will go on the end, is the same end as the feet. So the foot of the bed is facing that way. Your Mayo stand is going to go that direction as well. You're not going to want to put this many instrument pans on your Mayo stand because it's hard on this end. So at UW, if you can use a ring stand, it'll just be easier for everybody. That's kind of how they do it. I would bring all my ring stands over to this side of the room because this is the sterile side, and this is where you're going to be using your ring stands. So we've got 3 instrument pans, and we just happen to have 4 ring stands in here, which is perfect. There's a basin set in the pack, so we're going to need one of these ring stands for the basin set. And then we have 3 pans. So your standard case for UW has 3 sets. We have the Major 1 pan, which is all your ringed instruments and your knife handles. The Major 2 pan has retractors and your pickups and suction tips in there. We also have the long instrument pan, which depending on the general surgery case that you do, you may not need. But I want you guys to get used to counting it and seeing it because for belly cases you will open the long instrument. So there's 3 pans. Also on the case cart, here's a preference list that you'll see come up on the case cart that CS had, and they used this sheet to pick the items on this cart. So there's a basin in here which has IV fluids, saline, extra light handles, Tux pads, which is for the circulator. So we have all of our scrub stuff, but then the circulator has all of their supplies for this case as well for the patient. So you would want to take this bin that has all the extra supplies in it and go through it and pick whatever is not in the pack from here, whatever extras you would need. Another thing you're going to do is you're going to grab the preference list, which is not that one. It's a separate packet that's for the nurse and the circulator, and the nurse will usually have it at the computer station. And you're going to want to pick your suture. So for today, our purposes, I'm going to pretend to open these because they're not sealed, but this is kind of what we would use, some examples of what we would use for suture. So that's just what these bins are on the case card, okay? Another thing, the circulators are going to use prep stands. So I've got a Foley kit, prep set. The nurse usually has a couple different prep stands in the room. One for their positioning equipment and then some for the prep set. All right, any questions about case cart, what comes up? All right, the rest of the room. Another thing that we do as well is when you open, you're going to have garbage, and then you're also going to have extra linen. So it's pretty common to go in and see a linen hamper next to the bed if the patient's not really in the room yet when you come in to set up. And then our garbage is on our wheels, so we use this too. So this is kind of how the room should look before you start to open. Okay. And then any extras you have, gloves, suture, you can just place on the patient or a table. Okay, the room looks good. Now I'm going to put my mask on and I'm going to start opening. Another thing I want to show you guys that for sponges, since we're doing UW, UW now has Their laps, we have these green tags on them, and you guys can feel these. There's a little, I don't even know what they're really called. You can feel this within the sponge. It's just another safety measure to not leave sponges in the patient. So whether we have an incorrect count or not, we still do exactly what the policy says. We do our initial count and our 2 final counts. But then we also have a wand that we can wave over the patient to see if we have any retained sponges. So just so you guys know, when you get to UW, the sponges look a little bit different. This one doesn't have the green tags, and that's why they got rid of them. But at least we can kind of show you what they look like, okay? Info rights. The only thing I didn't have in here was my thoughts, so I'm gonna grab those.
I can't open that sequencing in the OR document. Where did you guys find the UW?
Is it in the outline?
Yeah.
Which outline?
For the one for today,
For the
the
case-
sterile
case
field.
What's that? Unit 9?
I thought it was 11.
Oh.
In the
I
council.
saw it in that one too. Yeah, I saw it in the count.
All right, so we can move that prep stand out of the way.
That would probably be over here.
Yep, we'll put it on the unsterile side of the room, let's run. All right, so let's have some keep open with me. How about the first 2 people, so Jana, maybe? And then who's the next one on the list? Brooke? All right, come on. All 3 of us will open together. You guys can shout out too. What are you gonna wanna open first? Okay. So we haven't learned sterilization yet, but this tape here, when the steam sterilizer, it turns these lines black, which I had to color because it wasn't actually sterilized. But that's just how it should look. Maybe I'll have you guys open one table and then the next 2 open the next table. Okay, so the UW pack, a little funky. We have a sterile drape in here that we put a second layer on our working table. So we're just gonna set this aside for now and then continue opening that. Push it back. Yep. That'd be great. Good job, guys. All right, the next 2 people.
I don't remember my order, I think I'm.
It's Alexa and Sarah.
Okay.
Sarah's
Okay,
not
so
here.
who's after Sarah?
Katrina.
She's in the back corner
Right.
behind Tiffany.
Katrina and Alexa. Good job, Alexa.
Is it always gonna be this close to everything?
You just have to move the table if I were you,
Yeah.
I'd push that that way. And you can always move, these are all on wheels, so feel free to move them wherever it's gonna be best. And then you wanna grab the corners rather than in the middle and open it up. All right.
Down there, see?
Yep. And then the next 2 people can open. Tiffany, come over here and open this. And you can open this and just plop it on that back table. Step back when you're opening the envelope style, there you go. Oh, that's supposed to be in there. Shannon, do you wanna open the basin set? Rather than touch it here, to keep it as sterile as you can, where would you maybe? Yes, yep. Squat, reach underneath. And then bring it to your sterile table, because then you don't have to walk in between two sterile fields, okay?
Be careful because the paper has memory. Sometimes, when you need to sit down, sometimes these corners will be up in the air. So if you turn this down and you put it here, right? If this corner is kind of sticking up like this, you're very close to contaminating your field. So just be aware of your corners. When I push it in, I find one that is really nice and down. It's going to go up and expect it.
Now I'm opening sterile suture, but I don't want videotape.
That was awesome. Great
Now my backside's videotape. Okay, and now instrument pans. Have you guys all practiced opening these? Okay, when you guys get to this point, who is it again that's first? Janet and Brooke? You guys, I'll have you guys open these together when you're coming. So straight up, check the filter, make sure it's dry. And then you can just place these on the patient bed, that's fine. It should have a count sheet in there. And then also, there's a sterile indicator, which is not on these pans, but I did mention this before, but maybe not everyone remembered. And in sterilization, I'll show you, but there should be an indicator on here that when you pop this lid, it's locked, you unlock it, and it'll tell you if it's sterile or not. Once again, our patient's really not in the room. All right, so you're not going to want to bring these pans right up to the tables. Can anybody tell me why? Right, because this part is not sterile. Obviously the inside pan is sterile. So usually what we do is just kind of take them, move them where they're kind of out of the way. So that's why we save these for last and we open them up. I know St. Mary's a lot of times will open them on their case cards are short. They'll open up their pans on there, and so after you scrub it, you can just walk over and grab them. So I want to make sure that I have a path to the gowns so that I can grab a gown easily and put it on. So suture, any extras would now be opened. The little thing's really nice to open in your basin because it's all contained. And then the gloves get opened onto the gown table. I'll get more gowns for, or more gloves for like the surgeons and stuff. I'll grab those later. All right, so it looks like I'm ready to scrub in. I have all my pans opened, I have my packs, I've got my extras. So now I can go and scrub. I'll come back into the room. Now this pack is backwards. If you're dripping, I would wait till you're not dripping too much. Reach over, grab a towel. Circulator.
You're very welcome, Mr. Lieutenant.
Okay, these cloth gowns are so much nicer than those paper gowns you guys have been practicing with. So you want to save your glove wrapper. at the end of our first 8 weeks, you guys will do this setup, and from this point, once you're all turned and tied, we start timing you, and you have 20 minutes to complete the setup. And that would be for either St. Mary's or UW, so you're gonna learn both, and you don't know which one you're gonna do. All right, so within this pack, at the top, this is our draping sheet for this back table. That's why I wanted to open it there. We have a Mayo stand cover, which is non-disposable, so it's cloth. It's a little bit trickier than sometimes the disposable ones, I think. And then we have another barrier sheet that is used on the patient for draping. And then we should have 3 more cloth gowns. So I'm gonna organize this table since I'm standing here, and that way I'm gonna do less movement and coming back and forth. So I'm gonna put my gowns in the back, stack up my towels, and stack those in the corner as well. When you guys are putting your gowns over here on this corner, make sure that the ties are not hanging down, because if they're hanging past the top of the table, then what? It's contaminated, and you have to get rid of it. For my Mayo stand, I'm gonna need like 6 towels, and I'm gonna need this to drape my Mayo stand. I think it's 6 towels. It's been a while. If I'm off, I might have to come back. 6. So I'm just gonna put this on the corner of my pan so I can drape that table. So I can come over here, move this over here where it's sterile, and I can still see it from the corner of my eye. All right. However it lies, you can't bring this up, so make sure you get it all contained on your table before you let the edges fall off. So now this is all ready for my instrument pans.
The other thing to be aware of is when you're doing these things, usually that the table is about this far away from the wall. Be careful when you're flipping things backwards, that it's not grazing walls, it goes down, or you're catching walls, it goes down. Be aware of your wall.
Okay, so I'm gonna move this out of my way because I want to get to my Nature 2 pan first. I should bring this over here so you guys can see me. Alright, now this is something I know I was telling you guys to like over exaggerate to keep sterile. When you're reaching into this pan, you don't want to touch the sides of that. So you somehow need to get these handles. And make sure the front of your gown, because they can get kind of puffy. If you're standing too close, you might contaminate yourself. So make sure you're kind of over exaggerating that. Oh, I don't want my back to the field. All right. I'm going to take my count sheet, and if my circulator's standing here, I can hand it to my circulator or chuck it on the table for them for later. Instrument pan. I don't want to keep this big bulky pan because here at UW I'll probably need 6 more pans. So I'm going to get rid of it and just take the contents out. So it's empty. Do that as long as I don't touch anything. And then here's my count sheet. So we have 2 racks of instruments in the long instrument set. They get counted as the total, so there should be 10 on each rack. I'll get to that. And then there's 2 long pickups, and they fit really well right here on the corner of my table. Okay, now I need to make a roll towel for my ringed instruments, because if I take them out and place them on the table, they're just gonna fall over. So if you use a roll towel, I take 2 of them, open them up completely, and I just start rolling. towel because I'm gonna have drugs. This is my working end of my back table, of my working table. Needle magnets, sharps, whatever, they're all gonna be laying here. So I like to have this towel out because if I spill anything back here, it'll get absorbed. And it won't just sit on that barrier drape. But then I also have just another layer for my sharps and whatnot. Right. So this is your major one pan. It has most of the instruments you guys have learned. Okay. So I've got these arranged in an order, shortest to longest. So get your mosquitoes pointing toward your working end of the back table, and then move up to the longest, where your needle holders and your sponge, your dressing forceps will be at the corner. We've also got towel clips on this rack. I'll just take those out. And then something that's easy to forget inside the pan are your 4 knife handles. You want to take those out, make sure it's empty, and then you can pass it off. So I'm done with all that, and I'm not going to touch those. The circulator will come by and grab those pans and get rid of them for me. Okay. So, here's my major one. All right, so for the most part, this is all organized and ready to count. These are pretty simple, they're ready to count. But this pan needs to be organized just a little bit. So our circulator is getting their stuff together for positioning and whatnot at this time, but they really need to go get that patient in the room before 7:30. So they're gonna wanna count instruments with me. So before I organize all this little stuff, I'm gonna try to get my instruments organized so that John can go and get our patient. Because if the patient's not back in the room at 7:30, they're gonna have to be on the computer even longer documenting why we had a late start. So our forceps are wrapped inside of this package, so make sure that when you're taking them out, you don't let these fall over the corner or the edge of the table. What I do is I just get rid of this whole thing. Save it, because we gotta rewrap. Okay, so there's a probe in there as well, so make sure you take that out and lay it out somewhere so that we can count it. Does anybody remember what this is? Bathroom. Okay, now I have a bunch of retractors in here. My stringer came off. We have malleables, Devers, which are pretty big, and we'll leave those in there. Body walls, which we leave in there. All right. Now all of our smaller retractors, I'm going to take out and I'm going to organize them so that when the nurse needs to count, they can see them. And then the other bigger retractors, I arrange them in pairs in the back of my pan so that the circulator can come by and easily count them. Something you should do is in your manuals, memorize the order of the instruments in the sets so that when you guys are counting them, you know that the first thing on here should be the mosquitoes and you know what they are. So all of these retractors come in pairs, these smaller ones. If you guys don't have these memorized perfectly, and the circulator will, say these off to you as well, because not everybody at UW knows the general instruments, because there's a lot of people that are in different specialties and don't work in general very much. But if you know them, you're really going to make a good impression on them. So we have a pull suction tip, which you guys haven't learned yet, but there's 2 pieces. So when you're taking it out and putting it together and ready, getting ready to count, make sure that you put the 2 pieces together and make sure they're on tight. Same with this Yankauer. Sometimes the tip of it is loose or off when they cleaned it, so make sure that's on there as well.
Those are only counted as one?
They're counted as one, but we do specify that both pieces are there. And that's your responsibility to know and keep track of. All right, I'm not too picky about how you guys have your pickups. Do what works for you, but I'm gonna tell you what I do because it makes sense. So at UW, for closing, at the very end of the case, we use our Ferris Smith on the fascia, and then our Adson pickups on the superficial tissue layer, so like the skin. A lot of people put them right on the end of their pan here because they know where they're at, so when they get to closing, they can grab them really easily. Our Singlies and our Russians, they come in pairs, but we don't use the Singlies or the Russians very much. So I usually put them back here on this side of my pan. And a lot of people at UW do this as well. The most common forceps that we use are our DeBakey's. So we have some regular length DeBakey's, and then we have some that are a little bit longer. And I like to put those right up front. We also have some Stillies, which look very much like DeBakey's, except for they have teeth. So you don't want to confuse those with your DeBakey's, because if a surgeon needs a DeBakey's and they're grabbing bowel, if you accidentally hand them something with teeth, they're going to go through that bowel and you're going to have problems. So if you put those the opposite direction and the surgeon asks for a longer DeBakey, you know not to grab those. You know these are your DeBakey's. Okay. That's how I do it because it just makes sense. And we do start out with using those Stillies. So now my instruments are organized and I can count with John. So John will come over here with a count sheet. And now this is part of, oh, I didn't tell you this. These are blue clips that come in our sets. They don't all look like this. Some of them look like this towel clamp, but they're blue and they're non-impervious, so they're not sharp. And we use them for our drapes or for the cords, like the Bovie cords, the suction cords, that thing, sort of thing, so that they don't fall off our drapes. So I'll just clip these back here so that John can see them. We'll start with our towel clips on our major one pan. And this one's plumbed. So it's our policy to show John the range portion of the clamp as I'm counting. So we have 2, 4, 6, 8, and 10. Some of them on here are sharp, impervious, and we have some that are non-penetrating. Doesn't matter, they're all counted as a total number of 10. All right, now I'm going to grab a knife handle because this works really well when I'm separating my instruments. You want to make sure that John can see them because he needs to verify that he counted these with me.
Normally I would be here to see better, but I can see back
Right.
so you guys can see as well.
Right. Okay. So leave your stringers on your instruments because it'll help them to not fall all over the place until after you've counted. So I'm going to start with my mosquitoes. So make sure you name them before you count them and count them in 2s, okay? Mosquitoes, 2. And see how well I'm separating them so that John can see that there really are 2. 4, 6. Kellys, 2, 4, 6. Cokers, 2, 4, 6, 8. Carmelts, 2. Alice, 2, 4, 6. Babcock, 2, 4. Peon, 2, 4, and 6. And then move on to the next set. These are tonsils or collars. It does this kind of an interchangeable thing. Tonsils, I have 2, 4, 6, 8, 10, 12, 14, 16. Westfalls, 2. And then I have 2 right angles. You don't need to name them. You can just say 1 and 1 or 2 right angles. One of them's a Rummel and one of them's supposed to be a Kantrowitz, but I don't think these are perfectly a match to that, but you guys will get the point. Long peons, 2, 4, 6, and 8. Scissors, we do a total number. 2. Oh, then there's 2 8-inch that have yellow tape. I don't know why it says that, it's just ridiculous. But everybody counts them together. Maybe I'll take a pencil and just put a little 8 on there or something if you want to do that. Okay, scissors, 2, 4, 5, 6, 8. Sorry, I did that because it's separated better. Needle drivers, I have 2, 4, 6, 8, 10. So there's 2 little ones back here, don't forget about them. And then I have 2 dressing or sponge bristles. And then I have 4 knife handles. So those are just total number as well. So I'm done with the major one. So just remember, you start with these, and if it's easier for you to put these here to remember to count them that way, fine. And then you end with your knife handles. Okay? You guys have so much information overload right now, probably, but we have to start somewhere. Okay, so now we're gonna go to our major 2.
Do you wanna do the major one again, but do it at regular speed? Just so that
Sure. 2, 4, 6, 8, 10. Mosquitoes, I have 2, 4, 6. Kelly's 2, 4, 6. Coker's 2, 4, 6, 8. Carmel 2, Alice 2, 4, 6. Babcock 2, 4. Peon 2, 4, 6. Tonsil 2, 4, 6, 8, 10, 12, 14, 16. 2 Westfall, 2 right angle. Long peon 2, 4, 6, 8. Scissors 1, 2, 4, 5, 6, 7, 8. Needle drivers 2, 4, 6, 8, 10, and 2 sponge sticks, and 4 knife handles. And some people count way faster than that. For me, I'd rather be able to verify it as a circulator, so going a little bit slower is better, and separating them. But as a student, you for sure need to separate because they're going to be watching more carefully because they don't know you and.
But that gives you an idea of what a normal count the speed is, so that
Yeah.
when we get to that point.
Yeah, and you're right, because it's hard, I think, for circulators when students aren't in the room sometimes. They'll be nice, but just know they have so much to do that you need to pick it up. So practice here in the lab before you get to clinicals. Oh, another point would be, so say you're going to like Reedsburg this semester, and then next semester you're going to UW. Come in here sometime during your break or whatever and go through. And if we're not, because I think Martin Luther's a day off and then Tuesday go right to clinical. Either way, review the setup in your manual. Do something to review it so when you get there you're not completely lost again because it's been 8 weeks, you know. All right, so our major 2 set is what we'll go to next. And I'll start with my refractors. So you want to make sure that your circulator can see. We have 3 malleables or ribbons in our set. Devers, I have 1, 2, 3, 4, 5, 6. I have 2 body balls. I have 2 Richardsons and 2 appendiceals. 2 Army Navies, 2 Rigs, 2 Greens, 2 Cheeks, 2 Veins. Oh, I forgot about my Balfour. Sorry, John.
That's okay. I would
Okay.
remind you.
So here's my Balfour. I have 1 wing nut. We count the wing nuts and 2 screws. So make sure they're on tight.
And your Velcro blade.
Oh yes, my Balfour blade. I have my probe. I have 2 suction tips, my yank cover both pieces, my pull both pieces. I have 2 Zimmer blue clips, which I think is at the end of the page. Pickups, we do a total number. So 2, and they're arranged in pairs, so it's really easy. You don't have to pick them up, you don't have to do anything. You can just go 2, 4, 6, 8, 10, 12, 14.
Correct.
Okay. And then my Zimmer blue clips. All right, and then I'll do my long instruments. These are the easiest because you don't have to know the names. You can just count the total number of them. 2, 4, 6, 8, and 10. And then 2 long pickups. All right, so I'm done with my instrument set. Now I can get ready with the rest of my setup. Any questions? You guys will learn your instruments really quick by doing the setups. So when we get to accessory in GI, you guys will already have a 1-up because you know what the sections are. which I guess there's not too many that we haven't learned yet. Towel clips. Okay, so here's our mail stand. It's on wheels. You guys get practice. I highly recommend practicing moving this mail stand without a drape and being sterile. Just get used to how it feels. You have to tilt it upward and get it on its wheels to move it. Okay, so before I touch that, I want to show you this drape. Just make sure you guys are doing it the right way. There's some folds in here. I'm going to put this back on my table, which would be no if I touch my mail stand. But if you guys look inside of here, show you. There's a fold. I didn't refold this. I'm hoping it's done right. But if you look inside of this fold, you can see a pile of material that can fold back. This is the way you want to put your hands in. You want to cup them in the mail stand, cover, and then grab a hold of the meat of the cover in your hands. Alexa, can you see me? Mm-hmm. So I'm like holding on to the meat of that. Because this is cloth, it's really slippery, so it kind of just falls apart on you. And then also, just like the puppet when we're opening, you kind of want to create an open mouth to put over the mail stand. I know you guys saw this kind of on the video, but I'm going over here to have you guys feel it, and now I'm going to start sliding this drape over the top. Make sure your foot is on the bottom part of the mail stand, because as you're pushing this on, it can run away from you. So if you have your foot on the bottom, you can slide this over the top. My hands are cuffed, so I'm not getting close to the unsterile portion of my mail stand. I've seen people do this where they take their hand and go to push. This is not good. It's not okay because you're gonna contaminate. It is okay to grab the end of this, being cloth, and it's super slippery on this mail stand, to just grab it, kind of push your belly or your body against it, and then you can push the edges. This is okay too. If you're shorter, sometimes it works good to get most of it on there and then stand to the side, hold the meat of your mail stand cover, and then slide it this way as well. Like that's okay for some people that are shorter. All right, and now I can touch under here, okay? This isn't like that table, the top only. This will be coming over the sterile drapes of the patient. You're gonna be able to like touch all this stuff, okay? That's okay.
Technically, by your manual and everything else, we talked about how the underside of the mail stand is considered contaminated by AORN standards, and that's what we teach you from the practical aspects. There's no reason for that. You will reach underneath that mail stand at some point, and there's no reason. It's what AORN goes by, and everybody goes by the AORN recommendations, but if the underside of that mail stand was actually contaminated, would you put it over your field, over your sterile drapes? No, so go out from that standpoint. We teach what AORN teaches, the standards that people follow, but from a practical standpoint, the underside of that mail stand is not contaminated.
So basically the rules of the tabletop apply to the actual tables. The mail stand is not a real tabletop, so. All right, so now I'm ready to organize all of my extras. I don't put any towels on the mail stand yet, because the way UW does it, we have to put our free ties on here underneath the towels. St. Mary's is a little bit different. Okay guys, now we have to remember how to put this pack back together. This is a newer pack than what I'm used to dealing with. So there's a warmer drape in here that was here in a gown, and then we had our laps, suction tubing, and our light handles are in there. And then there's also 2 rectangular basins with all of our extras, so our sponges, our Bowie, and all that. Okay. You need to help me.
Yeah, okay, sure.
Awesome, thanks Alexa. Okay, so this came in our sterile pack. If you guys are gonna use a warming drape, we have one in here so we can open this up and throw it over our warming basin. So I'll show you guys how to do that at the end of the case. It really won't be part of your setup. I'm not gonna require you guys to do it, but I do want, if you wanna add it to one of your guys' weeks of checklist so that you guys can properly drape those. But it's not part of your timed drape. All right, so we have leggings in here, and we also have an under the butt drape, which would be GYN. So we're doing general I'm one of those people, I like to save everything because I never know when or how I might be able to use it. Since we paid for it, I'm just gonna keep it. There's a suture garbage. Not everybody uses these. Some people like them. They'll take the sticky part off and line it up right like this. So you don't want to touch that bag anymore, you just leave it there. But you can open it up and throw your sutures and stuff that, not the needle, just the end of it that the surgeons came back. So now that it was below my table, I'm just gonna get rid of it. I don't want it.
I love the garbage bag.
So that way. I know. Okay, I'm just not gonna talk about the video. So the sections, they come sealed with a little wrapper, you can just take that off. I'll bring all this stuff. My basin. Got these, bring them over here. Now this, laparoscopic lithotomy. So this must have been a GYN pack, not a basic general pack. That's okay, we can work with it. I appreciate the fact that we got a new pack. Alright, so I'm gonna bring my basin set over here because I can empty it out and organize all my stuff. I actually have it over here. Alright, so now I'm gonna look for some ties as I'm organizing. Some people, when they're opening, they like to keep their ties and their sutures separate. Are you guys confused when I say that? Ties and suture? Huh? Suture has needles on it. So I separate all those. And then my packs of ties, you may have like 6 packages of ties. I just throw them up on my mail stand so I can organize them according to size. And I'll tell you guys how to do that. This will be garbage. See, I brought those sponges in here and I didn't realize we had those in here. So we have a whole pile of extras here. As I touch it, I'm gonna work with it so I don't have to touch it again, so that I can economize my movements. There's little paper on the back of this needle magnet that in clinicals for practice, I'm not gonna have you do it, but when you get to clinicals, take that off and then stick it down onto your drape. UW people don't like to use this goofy pad. St. Mary's, they like the goofy pad. I'm just used to not using it, but it is nice to organize like bigger needles in because it's numbered, so then when it's time to count, your needle's all nicely organized. Your blades, I'm not gonna have you guys open them. You can just verbalize to us that you're going to open them. When you get to clinicals, you do need to open them so that the circulator can see them when you're counting. I have had packages of stuff like blades that are counted come empty. So then you don't really have a blade and you count it that you have a blade. You just have a blade package. So it's our policy to open them.
Open them and put them where? Right there?
And your needle magnet, yep. All of your sharp stuff you can put right in there. So we do have pre-made drug labels in here. And our pre-made drug labels are specific to whatever pack or specialty you're using. This is my sterile garbage. Now I'm organizing all my counted items, and even my uncounted, just so I know where it is and how to make sure I don't miss anything when the circulator comes back to count with me. A lot of people at UW, if you have extra garbage, bigger garbage, they throw it under their basin. I can't remember if they did it at St. Mary's or not.
Yes.
I'm ready to count extras. So if the circulator is back in the room and it's a good time for them to count, the circulator might wanna count with me now. Alright, so we can start with sponges, it'll be fine. Once you break the tag, you count it right away. So people don't break the tags off until you count them, so just keep that in mind. So you want to completely separate your 4x8s. This is another thing that people do when they're counting their 4x8s, but we have to teach you how to completely separate them. When you get to like St. Mary's and stuff, I'm okay with you guys doing this as long as the circulator can see pretty much the entire sponge. Go with what the preceptor and circulator want, but there is a way to keep your sponges organized when you're counting. If you keep just the end of it laying on the table, as you're counting, they'll stay together and organized. So at the end of the case, if you only used one 4x8, at least they're somewhat organized and easy to count quickly. So here's 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Lap sponges. At the end, when we put these back together, I have rubber bands back here so we can rubber band these. So there's 2 ends to your laps. It's really hard to count on this end, so you want to count the folded end. And then you want to completely separate these as well. 1, 2, 3, 4, 5. And the second set. 1, 2, 3, 4, 5. And you can see I'm facing it toward John so that he can count with me and verify that. Another thing you don't want to do when you're counting sponges is you don't want to count right on top of the other package, because if this has 6 or 4 in it, you want to make sure they're completely separated. Okay, 1, 2, 3, 4, 5 for a total of 3. Any questions with sponge counting? Okay. Blades, I have 1, 2, 3. There's 1, 2, and 3. That way you guys will have this on video and know when you get to clinical if you need to open them. Alright, so 3 blades. I have 1, 2 Bovie tips, 1 scratch pad, 1, 2, 3, 4, 5 sheevers, and that's it for extras.
Again, we talked about this in class. If you have everything, if you're organized well and your setup is well, you can point.
1, 2, 3, 4, 5. It'll be faster. St. Mary's, you have to count your sutures with the circulator. UW, initially, you do not. Okay? Do you count this? No. Marking pen? No. Okay, good. What about these? You do not count clip cartridges.
Hospital-based, you go to other states, they do make you count those.
Really?
Really?
I did not know that.
I know, it's kind of scary.
Well, they get put in the patient.
I know.
Okay.
No, there's no rhyme or reason, but I know that there are other hospitals in other states that actually make you count the titanium clips, which makes no sense.
Okay. Okay. Good to know. All right, now that we're counted, John can go and he can help anesthesia or position the patient or whatever. All right, so on your ties, these are 3/0 silk ties. Very common for belly. Usually we have O silk, 2/0 silk, 3/0 silk, and sometimes 4/0. So you take these out of the package. I'm not going to have you guys completely undo them, but you could take this little silvery tag off. It's like hair. And you just completely open it up like this. And it's staticky as well. But what you want to do is you want to put the ties, once again, it's okay to hang it over the Mayo stand. It's going to be over a sterile drape and a sterile patient. It's all good. Eventually, when I bring this over the patient, I'm going to be standing over here on this far end. And so I want my ties closest to me on the back end of my Mayo stand. So I'm gonna arrange them this way from like largest to smallest, so O, 2O, 3O. But since I only have 3O, I'm just gonna leave it like that. When you guys are doing your setup, by all means practice doing that way. You wanna be able to see those. And now I can put my towels on my nail stand. Everybody towels their nail stands differently. You guys can pick up whatever works for you. I'm okay with that. UW likes roll towels for the ringed instruments. Alright, so now I'm ready to put instruments up. Take your strings off. Alright, I'm going to want something from each category. And for a standard belly case, if you have superficial bleeders, you can start out with a couple mosquitoes or a couple Kellys. I'm a minimalist. I don't like to put too much on there. 2 cokers, you're going to want to grab for sure. It's kind of a standard for UW. I just go down the line. So I grab 2 cokers, clamp them on the very first ratchet. Tonsils, we have like 16 tonsils, so that's just a big fat hint to you that UW, for when they ask for a clamp, it's probably going to be a tonsil once we get into the past the peritoneal layer. And then they also use the tonsils for our ties. So grab 2 tonsils per however many different size ties you have. So since we have just one size, I'll grab a couple of these and put them up here. And then the cokers and the tonsils up here. Alright, Westfalls. A lot of UW doctors like the Westfalls for dissection. So I grab a couple Westfalls and put those up as well. And then I go to my scissors. So you do have regular length and long scissors up here. There's 3 that you're going to want to grab. I have a Metz, a curved Mayo, and a straight Mayo. So the Metz would be for more delicate tissue. Straight Mayo is what?
Sure.
Exactly. And then the curved Mayo would be for heavier tissue. You're going to need a heavy needle driver to load your blades onto your knife handles. So I grab that out, put it over here. Okay. So I've got scissors and I've got clamps. What else do I need up there?
Retractor?
Yep, I need retractors. You're pretty safe if you put up a couple greens, because that's what they usually start out with. And then later it's surgeon preference. Some people put up a couple Army Navies and a couple greens because some doctors like the Army Navies better. So when you guys get there, do whatever you want. If you know where it is on your back table and you're quick and can reach them and grab them, fine. Give me a good rationale why you put whatever up there when you're getting tested off. What else do I need? Yes. Right. So I've got my Stillies, which have teeth. So starting out, I'll put my Stillies up and I'll just grab a couple of the shorter DeBakey's, which are atraumatic, so for delicate. So that's our basic setup right here. For the Stillies, after we'll use it for skin incision, for picking up tissue like the peritoneal type of tissue. Once they see the contents like bowel and stuff in the intra-abdominal contents, take these Stillies and put them back. If you don't have time to put them back, just throw them on your back table. Because once we're through and you can see like the bowel and stuff, you don't want to accidentally grab them. So they only use the Stillies for like a couple minutes to start with, and then sometimes they may go back and ask for them if they're doing, you know, if they're needing them for something else. Then you could go back and grab your longer DeBakes too. But to start with, you grab those and your stillies. And we'll grab some of our sponges. Actually, put those up here. You could, some people at UW do this, some just put it in their basin. I don't care, whatever works for you. But you can cover that. Bring up your Bovie, your light handles. You're gonna bring up your suction as well. And there you go, you're ready to start. Marking pen as well.
Where do you put your list?
My blades, I leave them back here. So at UW, we don't leave our blades on the mail stand. After you load your blades, when you start, I know some people will put, you know, like the number 10, they'll put that here next to their scissors. And then after they make that first initial incision, they'll take it and they'll put it back by their needle magnet. So let me show you what I have for instruments again so you guys can see them. I'll need a new skin marker. So 2 cokers, 2 tonsils, 2 wet balls. If you want to put a couple superficial clamps like mosquitoes or Kelly's, I'm fine with that. So when you actually get to your clinical site and they need a superficial bleeder clamp, that would be good. A couple stillies, a couple DeBakey's, greens, your Mets, your curved mayo, your straight mayo, and then for however many ties you want to get that many clamps with them. I'm not going to have you practice loading the clamps on the ties when you're doing your setup, because this is a skill that you're going to perform in a different room and get tested off on. I think starting next week maybe, we have some intra-op passing. You guys will then have to load ties and do more of the skills after your setups, like draping the patient, passing off your Bovie and your suction tubing to the circulator, and then bringing up all of these tables to the patient once they're draped, and then passing instruments to Carolyn. Usually she starts out being the surgeon. So all those skills that you do like during the surgery, we will practice in a different room. But for right now, this is what we want you guys to do in the 20 minutes time. Okay? The reason I put this towel over my instruments is because when you grab like the tubing, oops, it won't stick to your instruments. That's why a lot of people do that. Okay? Now that I'm ready to go, I could come back here if you have time. See how much room I have on this back table? Now I can put like my book Walter retractor, which we showed you guys pictures of the big rings and all that. There's 2 pans for that. So I could line those up here, or whatever extra pans I have room for them. I'm going to need gloves for my surgeon. The surgeon will come in, and at this point I would turn around and gown and glove the surgeon. But if they're not ready for that yet, I'm going to open some other drapes I think in here, but I'm just going to pretend this is a lap sheet. So this is our basic drape for a belly case. And this is the order that you want to organize them in. So this will be the last drape that we put on, so we'll lay it on the bottom of the table. This drape, this barrier drape, will go over the patient's legs. So we'll put that on top of the barrier, and then 4 towels. If you have time before the surgeon comes back and you have all your medications, you are set to go, you can come back here and even open up these towels, and this is how you do it. You'll have to do this with Carolyn too. Ooh, that was folded wrong. So I'm leaving this with 1 fold to go over the patient's abdomen to do a landscape around the prepped area. All right, so when you unfold these, do 3 of them with the folded corner up, and then the last drape. We haven't gone over draping yet, so it might be a little confusing to you what this all means, but we'll cover it. And then this one with the fold put on top. And I won't they would, most surgeons like 4 towel clips. You could put 4 towel clips over here just to get, you know, that way the surgeon's not waiting for you once you start draping. Some doctors like to use a stapler with their towels, and we did talk about that a little bit. I don't have a stapler open, so that's something I would have to think about. Like if I'm working with Dr. Matsky, I know he likes a stapler, so I need one of those.
Usually that comes in our package.
Oh, that's nice. Alright, I think that's it. Any questions? No. I'm not gonna have you guys practice loading blades for your timed setup, because once again, that's a skill that you guys will be performing in another room. So loading and passing suture, loading and unloading blades, will all be done in another room. If you guys look at the end, oh, you guys probably don't have it yet. Never mind, maybe I'll show you. I think I'll make a copy and bring it in here of your skills test-off sheet, the actual rubric. I'll make copies of it and bring it in here and tape it up on the board. You guys can look at every skill that you guys have to do and get and test off on and pass. If you don't pass on each of these skills, you guys have to go to clinicals. Okay? So it's a big deal. So gowning and gloving, scrubbing, your timed method or stroke method, all that stuff you'll be tested off on. Loading left-handed suture and right-handed suture and passing it correctly. Aseptic technique, so are you contaminating it all while you're doing your setup? Or any of your skills for that matter. Open gloving, it all kind of comes together on the last 8 weeks, there's one day that you guys will come in and do that.
Reps. Do it over and over and over again.
And it's really, when you guys are in here with each other, the more you watch each other and help each other, like put the set together and look at the instruments and go through it and count with them. So, Brooke, your second, you'll be circulating. So when you're in that circulating role, that's actually gonna help you remember these instruments too, so that when you're next to scrub, you've got one up. The next 2 people in line, or whoever's in here volunteering to be in here to help and, you know, observe, the more active role you play in, you know, helping clean up and just observing, take as many notes as you want, it'll just come much quicker for you. I've noticed in the last year's groups, the people that were in here and were active participants were the ones that were picking up on it like that, and were doing their setup in less than 20 minutes, or 20 minutes, which is fine.
So meds come in.
Meds will come whenever the circulator has a chance to do it.
Meds.
Most meds, a lot of times, laparoscopic cases will give the meds before the start, you know, before they do the trocar, so you want it at the beginning of the case. Some cases, the meds won't be until the end, so it's not that big of a deal. But the circulator has a bunch of stuff to do, so she will give you saline and give you your meds before the case starts, but it'll kind of be when she has a chance to do it.
Right. And sometimes you're in the middle of doing your setup and it's a good time for the nurse. The nurse will come by and be like, you know, here's 1/4% marking, so you need to know where your med cup is, verify what information,
Type and expiration date.
expiration date, what it is, yep. And then you write that on your, this is so long. Usually we have some blank ones in here too, and there are some here. So what it is, the expiration date, and St. Mary's policy, and I think AORN standard is that you also write your initials on there as well. Does anybody do that?
No.
Expiration date, initials, and what the med is.
Right, we usually just, yes, that's this, how would you like me to answer this one?
Okay, I put you
Yes.
on the spot.
Yeah, yes, that's the ARN standard, but from a practical standpoint, why the expiration date?
Because
you
it's-
see it and you verify it.
It's
and you
proof
write
you
on the
verified
thing.
it. And there are techs at St. Mary's that do it that way.
Correct. But
So,
I
and
think
they'll
probably most
say,
everybody will
weren't
write
you
down.
guys taught to do that? But there are a lot of people that just put the drug. And usually if you have a lot of meds, I mean, you're in a hurry anyways. You have to write one for the syringe, you have to write one out for your med cup, and you're flying, so it's just a more busy work, but just so you know.
Online, your initials are everywhere, all over that operating room, right?
If you can get the drug and the expiration date, I think most people are happy with that. I hope I didn't forget anything.
Can we take pictures of the table?
Yes, feel free.
You pretend like this didn't fall.
Yeah. next person to put their sleeves in. So just tie it. Usually it's just the right sleeve that's in there, but I think St. Mary's does both, right? Either way, I don't really care what you do with the sleeves, but one of them should be tucked in the strings. Okay, and then, this is kind of gross. This is why we get hair and stuff on our stuff. If you guys want to put it on the counter, that's probably better. But if you lay this on the part of the gown, the inside part that touches your scrubs, just lay it flat on the counter. You guys will never have to refold these again unless you work in reprocessing. But for here, we all need to work together to get this done so we can get everybody through the setups quickly. All right, so I'm folding the material up to this crease and just folding it in on both sides. And then all you have to do, and another thing that I like to do is I take the strings and make sure they're folded down so that they're not going to hang over the table when I put it back on the table. So the two armpits, you just want them to meet. And then you just fold 1, 2, 3, and then 4. So it's a pretty simple fold.
Much easier
Okay.
than the disposable.
I know. And then when you guys scrub in and have to grab a gown from the table, you just grab right in the middle and pull it away from your sterile table and then put it on you. So you can see this is going to be my right hand. So when I grab it, I can just grab the other side with my left and then find the armholes and it'll slide right on.